this is World Insight. The World Health Organization has sounded the alarm over the monkeypox outbreak in dozens of countries, qualifying it as a global emergency. That steps up efforts to treat the disease and produce vaccines. So what does a global emergency status exactly mean for the monkeypox? So how alarmed should we all be? Let's ask our panelists. For the latest discussion on monkeypox, in Seattle, Dr. Alice King-Kyang-Tan, internist at the Ms. Medi Women's Hospital. In San Francisco, Peter Chin-Hong, professor from University of California, San Francisco. Good to see both of you. The WHO declared monkeypox a global emergency over the weekend. Now, how much do we know about this disease and its danger? Alice.
Well, first of all, monkeypox is not a new disease. The first cases in humans was detected back in 1970. And since that time, there have been sporadic outbreaks. They have been successfully controlled in the past. This time is a little bit different because the numbers affected is unprecedented for monkeypox. And so I think that's why the WHO decided at this time to declare it as a public health emergency of international concern. They want to try to nip it in the bud, so to speak, before it gets to a very serious state.
And I think there are three things, really. There's social networks, sexual networks, and globalization that really makes this very, very different. From when the last time the WHO met in June, cases have increased by more than 5 times until this last meeting.
What about vaccines? What about special medicine that is going to help us directly to deal with monkeypox? Would early practices and experiences valuable now since the disease has already exploded outside the African continent, Alice?
Well, in terms of the vaccine, there's only one company in the world that has been manufacturing this vaccine, and it's a country in Denmark, Bavarian Nordic. And they were recently approached by the European CDC, I think, to make more than 100,000 doses specifically for Europe. Europe is the hot spot other than North America right now. But that means the rest of the world is having to stand in line. And of course, this is a very familiar situation. And so I think in terms of equitable distribution of vaccines, that's going to be very important, but also targeting who needs the vaccines in terms of pre-exposure prophylaxis, post-exposure prophylaxis. We want to make sure that the people who are getting the vaccines are the people who will benefit the most from these vaccinations. And for right now, it's not the general public. And so even though the declaration of monkeypox as a public health emergency of international concern, it's a way of raising awareness. It's a way of getting countries and governments to start to mobilize. At the same time, we don't want to cry wolf. We don't want to alarm the general public and make people feel like everyone has to get vaccinated for monkeypox, just like we're trying to promote vaccination for COVID-19. It's not a similar situation yet. And so the messaging is going to be very, very important going forward.
Right. At this moment, there's a lot of talk about whether this is going to be one of those sexually transmitted diseases, just like HIV at the very beginning. And also whether this is mainly, as indicated by numbers so far, transmitted among people who have man-to-man sex. So how do you see the research related to the latest rounds of explosion of monkeypox? Do we know really much about, which social group are likely to be more targeted? How aware the public, the general public, the mass public should be?
Right now, it's mainly concentrated among men who have sex with men, but it's not a sexually transmitted infection in the same way. Sure, you can find it in bodily fluids, but simply skin-to-skin contact is enough to transmit the infection as we know it. There have been transmission in households. For example, in the United States, on Friday, we had the first 2 cases of children diagnosed. So I think it's important to focus on this population, but not be limited to that way of thinking. And, when people try to think of it, oh, it's a sexually transmitted infection, they don't normally think of themselves at risk. But I think it's important, again, not to panic, but to think broader than just thinking of it as a sexually transmitted infection.
There are many diseases that are transmitted around the world. We also see different kinds of pandemics even. So is the declaration declaring monkeypox as a global emergency an accurate one? For example, there might be others that are of a similar degree or even more emergent matter.
As I said, messaging is going to be very important. We need to be very truthful about what we know right now about monkeypox, because one of the problems with COVID-19 was there was so much misinformation and mistrust, and I think that really accelerated the spread of COVID-19. We need to be very clear about what we know about monkeypox. And in terms of the way that it's transmitted, there's research dating back to 1983 that was done in Tulane University School of Medicine that showed that the monkeypox virus was viable in the air for up to 90 hours. And so we do need to do some digging and let people know of what the science has shown about this virus so that we can take the proper precautions.
This is a golden opportunity to not have this disease become endemic in parts of the world where it hasn't been endemic before. It's mainly in West and Central Africa. But if we don't intervene now, and if we don't have a coordinated effort, this may become part of our normal landscape. And when somebody comes in with a rash in 5 years in North America or in Asia, you'd have to think about monkeypox, and we don't want that to happen.
But the other thing is the fatigue that we see because of the years of fighting against the COVID-19, and people have been, the economies, the societies are suffering, challenged, struggling, while at the same time trying to stand up again. And yet they will say, oh, another one. Oh my God, I can't deal with this anymore. You see comments like this in the public a lot. So how do you see reactions of fatigue? Would that help with the general attitude and also efficient ways of dealing with monkeypox?
This is very different from COVID because we already have a PCR test, we already have vaccines, and we already have therapeutics like tecovirimat. So I think, trying to focus on that and the fact that it is very different from COVID because the mortality rate is very, very low, particularly in the developed world. So I think that will be a basis to start. But also I like starting off by saying empathizing with the people and what they're feeling, including myself.
Alice?
The WHO outlined a plan, and I think it was a very wise plan, and they did take into account the social and the psychosocial aspects of this disease. Making sure that we do not stigmatize this disease is also going to be very important, because the last thing that we want is for people to go underground, and then it just makes the problem worse. And so really talking about this, being truthful, being open, and being positive. We can get this disease under control. We can stop human to human transmission, but we need everyone to cooperate. We need the government to step up. If someone has to be in isolation for 21 days, that's a long time. We need to make sure that we have a support system in place so that they can do in isolation for 21 days, that they have their essential supplies, that they have support from their employers. Yeah. And so there is a plan in place that the WHO has laid out. I think it's a matter of getting people on board.
People worry whether there's any link between COVID-19 and monkeypox. Of course, that has already been scientifically explained that these two are very different viruses. And yet the news about one gentleman who has been infected by both at the same time has caused quite some concern. From your scientific background, how do you see these quote-unquote potentials? Alice, please.
It's all about education. It's all about clearing the air, having discussions, answering questions, having people ask questions if they want to know, and having the experts answer these questions in real time. I think that's going to be very, very important, and just being upfront and honest about it.
Peter.
Well, I think this is the seventh global emergency of international significance since 2007. And I think it's fueled by deforestation, globalization, and climate change. So it's no surprise that we're seeing more and more of these. So I think acknowledging that is important. It's just the way in which monkeypox is spread supports the fact that you'll find other things. So I'm not alarmed by it. I'm not surprised by it. But I think telling people that it's normal, it's not usual, but it's also a normal part of medicine, I think, and science is going to be important.
Peter Chin-Hong, Alice Kim-Kyung-Tan, thank you so much for both of you helping us to explain and understand much better what we are facing right now, another global emergency, monkeypox. Thank you so much. All the best. Really appreciate it.